Imagine this: you finally drift off to sleep, only to be jolted awake, again, by that urgent need to get to the bathroom. You stumble out of bed, make the trip, then struggle to fall back asleep. An hour later, it happens again. For millions of Americans, especially those living with diabetes, this isn't just an occasional inconvenience. It's a nightly, exhausting ritual that robs them of restful sleep, drains their energy, and chips away at their quality of life. This constant battle with nighttime urination, known medically as nocturia, is all too common. What if I told you that beyond managing your blood sugar, there are specific, often overlooked, nutritional keys, certain vitamins, that could significantly reduce these disruptive trips and give you back your peaceful nights? Studies show that poor sleep dramatically impacts overall health, especially for diabetics, affecting everything from blood sugar control to mood. You're not alone, and there are solutions beyond just cutting down on evening drinks. Hello, I'm Dr. Michael Bennett, a nutritionist with over 20 years of experience in health and wellness. With years of experience helping individuals navigate the complexities of diabetes, I've seen firsthand the toll that interrupted sleep takes. Today, we're not just scratching the surface. We're diving deep into why diabetics experience nocturia, and more importantly, we'll unveil 5 essential vitamins, backed by science, that can be powerful allies in helping you regain control over your nights. We'll explore how they work, which foods are rich in them, and crucial safety considerations. Before we begin, a critical disclaimer. This video provides general educational information and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider before making any changes to your diet, starting new supplements, or adjusting your medication, especially if you have diabetes or other underlying health conditions. Your personal health journey should always be guided by your medical team. If you're ready to reclaim your nights, hit that like button, subscribe to our channel, and ring the notification bell so you don't miss out on our evidence-based health insights tailored for you. Decoding nocturia: why diabetics wake up at night. To truly tackle night urination, it's vital to understand its root causes, especially for those living with diabetes. It's not always just about high blood sugar. There are several interconnected mechanisms at play. First, let's talk about osmotic diuresis. When blood sugar levels are too high, your kidneys work hard to filter out the excess glucose. Sugar acts like a magnet, pulling water with it as it's excreted in your urine. This leads to increased urine production, especially at night when your body redistributes fluids. This is why managing your blood sugar is always foundational. Next, we have diabetic neuropathy, specifically autonomic neuropathy. Long-term diabetes can damage the nerves that control your bladder. This can cause your bladder to become either overactive, contracting involuntarily, or conversely, it might not signal fullness properly, leading to incomplete emptying and overflow, requiring more frequent trips. Another significant factor is fluid redistribution. If you experience swelling in your legs or ankles during the day, when you lie down at night, that accumulated fluid moves back into your bloodstream. Your kidneys then filter this extra fluid, leading to an increase in urine output. This is a common issue for older adults and individuals with heart conditions or diabetes. An often overlooked cause, yet common in diabetics, is sleep apnea. When you experience intermittent pauses in breathing during sleep, your body can release certain hormones that signal the kidneys to increase water excretion. This can lead to frequent awakenings and the need to urinate. Finally, we consider the impact of antidiuretic hormone, ADH. In healthy individuals, ADH, also known as vasopressin, naturally increases at night to concentrate urine and reduce its volume, allowing for longer stretches of sleep. In some people with diabetes, this process can be disrupted, leading to a higher output of dilute urine throughout the night. Understanding these underlying causes helps us realize that supplementing with specific vitamins isn't just a random shot in the dark. It's about supporting crucial physiological processes that are often compromised by diabetes. Vitamin B6, Pyridoxine, the nerve and blood sugar balancer. First on our list is vitamin B6, or Pyridoxine. This often underappreciated vitamin plays a critical role in several bodily functions that directly impact night urination in diabetics. Its key roles include Supporting nerve health, B6 is essential for the formation of myelin, the protective sheath around nerve fibers. With diabetic neuropathy, the cables transmitting signals to your bladder can be damaged. B6 helps protect and potentially repair this damage, improving bladder control and your ability to recognize fullness signals. Regulating blood sugar, it's involved in glucose and glycogen metabolism, helping your body utilize insulin more effectively. This leads to better blood sugar stability and, consequently, reduces the amount of sugar expelled through your urine. Serotonin production. B6 also aids in the production of serotonin, a vital neurotransmitter for healthy, restorative sleep. Deeper sleep naturally reduces the number of times you wake up, including for night urination. Scientific evidence. Observational studies have indicated a link between lower B6 levels and higher HbA1c readings in diabetics. Small clinical trials have also suggested that B6 supplementation may improve symptoms of peripheral neuropathy, including those related to bladder function. Rich and accessible food sources. You can find abundant B6 in salmon, chicken, potatoes, bananas, chickpeas, and sunflower seeds. Dosage and time to efficacy. The general recommended daily allowance is 1.3 to 2 milligrams per day. In some therapeutic cases, under medical supervision, doses ranging from 25 to 100 milligrams per day might be prescribed. You might begin to see improvements in blood sugar and neurological symptoms after 4 to 8 weeks, with a noticeable reduction in night urination potentially occurring around 2 to 3 months. Important warnings and interactions. While B6 is crucial, prolonged high doses, typically above 200 milligrams per day, can ironically lead to peripheral neuropathy, causing numbness or tingling. Always consult your doctor before taking high doses, especially if you are taking medication for Parkinson's disease, such as levodopa, as B6 can reduce its effectiveness. Vitamin D. The sunshine vitamin's nighttime secret. Next up is vitamin D, often called the sunshine vitamin, and its surprising role in managing nocturia. Its influence extends far beyond bone health. Its key roles include regulating insulin function and blood sugar. Vitamin D plays a pivotal role in insulin production and the body's sensitivity to insulin. Optimal vitamin D levels help the pancreatic beta cells function better and improve how your body responds to insulin, thereby stabilizing blood sugar and reducing osmotic diuresis. Bladder health and pelvic floor muscles. Your bladder and pelvic floor muscles contain vitamin D receptors. A deficiency in vitamin D can weaken these muscles, potentially leading to reduced bladder control and increased night urination. Fluid control and vasopressin hormone. Vitamin D can influence the hormone vasopressin, ADH, which helps your kidneys concentrate urine at night. Low vitamin D levels may disrupt this crucial process. Kidney function. It helps protect the kidneys from inflammatory and oxidative damage, reducing the risk of diabetic kidney disease. Scientific evidence. Numerous large observational studies have revealed a strong connection between low vitamin D levels and increased night urination in older adults, including those with diabetes. Intervention trials have also indicated that vitamin D supplementation can improve kidney function in patients with early-stage diabetes. Rich and accessible food sources. You can find vitamin D in fatty fish like salmon and mackerel, fortified milk and cereals, and egg yolks. And, of course, safe sun exposure. But remember to be mindful of sun safety guidelines. Dosage and time to efficacy. The general recommendation is 600 to 800 IU per day. However, many diabetics may require 1,000 to 2,000 IU per day, or even higher doses, e.g., 50,000 IU per week, under medical supervision if a severe deficiency is present. You might see improved vitamin D levels and blood sugar control after 4 to 6 weeks, with a reduction in night urination potentially occurring after 2 to 3 months. Important warnings and interactions. The most crucial step is to get your blood tested to know your current vitamin D levels. Excessive vitamin D intake can lead to hypercalcemia, high calcium levels in the blood, which can result in kidney stones, nausea, and muscle weakness. Be cautious if you are taking heart medications or thiazide diuretics. Vitamin A, bladder's protective shield and pancreatic ally. Next, let's turn our attention to vitamin A, a powerful nutrient often associated with vision, but which also offers significant benefits for bladder and kidney health, especially in the context of diabetes. Its key roles include protecting the urinary tract lining. Vitamin A is essential for maintaining the integrity of the epithelial lining mucous membranes within the bladder and urinary tract. A healthy lining helps prevent inflammation and urinary tract infections (UTIs), which can irritate the bladder and increase urination frequency. Antioxidant and anti-inflammatory. As a potent antioxidant, vitamin A helps protect cells from damage caused by oxidative stress, a common factor in diabetes that can negatively impact the kidneys and bladder. Supporting pancreatic function, vitamin A plays a role in the health of pancreatic beta cells, which are responsible for producing insulin. Supporting this function indirectly contributes to more stable blood sugar control. Scientific evidence. Observational studies have suggested that adequate vitamin A intake is linked to a lower incidence of kidney dysfunction and better nocturnal fluid regulation. Rich and accessible food sources. Excellent sources include carrots, sweet potatoes, dark leafy greens like spinach and kale, red bell peppers, and liver, which should be consumed in moderation. Dosage and time to efficacy. The daily recommended dietary allowance is 700 micrograms RAE for women and 900 micrograms RAE for men. You might see general functional improvements after 6 to 8 weeks, with more noticeable improvements in kidney and bladder tissue health potentially occurring around 3 months. Important warnings and interactions. Vitamin A exists in two main forms: preformed vitamin A, retinol from animal sources, and provitamin A carotenoids from plant sources. Preformed vitamin A, especially from sources like fish liver or high-dose supplements, can be toxic in excessive amounts, leading to nausea, dizziness, and even liver damage. Pregnant women need to be particularly cautious. Carotenoids from plant sources are much safer because your body only converts the amount it needs. Vitamin C, ascorbic acid, the anti-inflammatory and vessel supporter. Our fourth essential vitamin is vitamin C, or ascorbic acid, renowned for its immune-boosting properties but also vital for managing night urination in diabetics. Its key roles include powerful antioxidant. In diabetes, the body often experiences high oxidative stress, damaging cells and blood vessels, particularly in the kidneys and bladder. Vitamin C is a strong antioxidant, neutralizing these free radicals, reducing inflammation, and protecting crucial tissues. Blood vessel health. Vitamin C is critical for collagen production, a main component of blood vessel walls. Healthy blood vessels ensure good blood flow to the kidneys and other organs, optimizing their filtration function. Immune support and UTI prevention. A robust immune system is vital for preventing urinary tract infections, a common cause of increased urination frequency. Vitamin C can also help acidify urine, creating an environment less favorable for bacterial growth. Indirect blood sugar control. While not directly regulating blood sugar like insulin, vitamin C helps reduce cellular damage caused by high blood sugar, and some studies suggest it may slightly improve insulin sensitivity. Scientific evidence. Studies have demonstrated that vitamin C can help reduce fasting glucose and oxidative damage in individuals with diabetes, as well as improve insulin sensitivity. Some research has also shown a reduction in UTI frequency among those supplementing with vitamin C. Rich and accessible food sources. Abundant sources include oranges, bell peppers, red/yellow, strawberries, kiwi, broccoli, and tomatoes. Dosage and time to efficacy. The daily recommended allowance is 75 milligrams for women and 90 milligrams for men. In some cases, a doctor might recommend 500 to 1,000 milligrams per day for additional support. General benefits may be observed after 4 to 6 weeks, with improvements in urinary tract health potentially visible around 2 to 3 months. Important warnings and interactions. While vitamin C has low toxicity, very high doses, above 2,000 milligrams per day, can cause digestive upset like diarrhea or nausea. More importantly, for individuals with a history of oxalate kidney stones, high doses of vitamin C may increase the risk of stone formation. Vitamin E Tocopherol, the cell protector and insulin booster. Finally, we come to vitamin E, a fat-soluble antioxidant powerhouse that plays a significant role in cellular protection and metabolic health, offering benefits for diabetics experiencing nocturia. Its key roles include extremely potent antioxidant. Vitamin E is one of the most powerful antioxidants, protecting cell membranes from oxidative stress damage. This is particularly crucial for nerve cells, kidney cells, and bladder cells, all of which are vulnerable to damage in diabetes. Enhancing insulin sensitivity. Numerous studies indicate that vitamin E can help improve the sensitivity of cells to insulin, enabling the body to control blood sugar more effectively. This, in turn, reduces the burden on the kidneys and the volume of urine produced. Kidney health and inflammation reduction. By reducing inflammation and oxidative stress, vitamin E contributes to protecting kidney function, potentially reducing proteinuria, protein in the urine, a marker of diabetic kidney damage. Improving blood circulation. Vitamin E also supports blood vessel health, ensuring better blood flow to organs, including the kidneys and bladder. Scientific evidence. Clinical trials have shown that vitamin E supplementation can significantly reduce fasting glucose and HbA1c levels in individuals with diabetes, leading to improved blood sugar control and related urinary symptoms. Rich and accessible food sources. Excellent sources include sunflower seeds, almonds, spinach, avocado, and vegetable oils such as wheat germ oil, sunflower oil. Dosage and time to efficacy. The daily recommended allowance is 15 milligrams or 22.4 IU. In some therapeutic cases, doses of 200 to 800 IU per day may be prescribed. You might see improvements in nerve function and blood sugar after 6 to 10 weeks, with a reduction in night urination potentially occurring around 2 to 3 months. Important warnings and interactions. This is one vitamin that requires careful consideration when supplementing. High doses of vitamin E can increase the risk of bleeding, especially if you are taking anticoagulant medications like warfarin or if you are about to undergo surgery. Always inform your doctor about all supplements you are taking. Summary: holistic strategy. So, we've explored 5 crucial vitamins, B6, D, A, C, and E, that can be powerful allies in reducing night urination for individuals with diabetes. They support nerve health, regulate blood sugar, protect the bladder, and enhance kidney function, all contributing to more peaceful, uninterrupted nights for you. Remember, this isn't just about fewer trips to the bathroom, it's about reclaiming deep, restorative sleep, restoring your daytime energy, reducing the risk of falls when navigating in the dark, and most importantly, significantly improving your overall quality of life. However, vitamins are just one piece of the larger puzzle. To achieve optimal results, you need to combine supplementation with a comprehensive management strategy. Strict blood sugar control. This is always the most critical factor. Adhere to your diet, exercise routine, and medication as prescribed by your doctor. Timely fluid restriction. Cut down on fluid intake 2 to 3 hours before bedtime, but do not restrict fluids entirely during the day. Avoid evening stimulants. Limit caffeine and alcohol, especially in the evening, as they have diuretic effects. Daytime activity and leg elevation. This helps reduce swelling and fluid redistribution, preventing fluid from overloading your kidneys at night. Discuss medications with your doctor. If you are taking diuretics, ask your doctor if it's possible to take them earlier in the day. The bottom line is this: always consult your doctor or a qualified nutritionist before starting any supplement regimen. They can help you determine if you have a specific vitamin deficiency and provide safe, appropriate dosages tailored to your health condition and any medications you are currently taking. If this video was helpful, please leave a like and share it with anyone you think needs to hear this information. Do you have any experience managing nocturia? Comment below. We always want to hear from you, and your questions help guide our future content. Don't forget to subscribe to our channel and turn on notifications so you don't miss our next in-depth videos on diabetic health and healthy living. Thank you for watching, and here's to many nights of peaceful, restorative sleep.